Hi, I'm Dr. Rich. Thank you so much for joining me to read another panoramic x-ray. So if you're new here, please check out my other video titled How to Read a Panoramic X-Ray. In that, I'll go over the basics of what, give you an idea of what you're looking at. This x-ray is a little bit more advanced than that last x-ray. The first x-ray was actually a person in their late teens who had pretty much perfect teeth, no cavities, no fillings, no crowns. The only issue they had was a couple of impacted wisdom teeth. Now, this x-ray that you're looking at right now, this is going to be let's say almost the exact opposite of that first x-ray. This person you're looking at somebody who has what's called a quote unquote terminal dentition. So this person hadn't been to the dentist in quite a long time. They knew they had a whole bunch of problems. They had a lot of loose teeth. They were having pain, some swelling. They needed to get something done, and they knew it wasn't going to be pretty. What needed to be done? They knew they needed a lot of work. All right, so let's start off with this x-ray. First thing you can notice is right in the middle, there's that vertical kind of really bright whiter area where you can't see the teeth as well. That is just an artifact. That's actually the person's spinal cord superimposed over that part of the mouth. The panoramic x-ray machine, the x-ray head actually has to spin around the person's jaw head, so the film or the sensor is on one side of the person's head, the x-ray source is behind, and they spin around together in tandem. So right there in the middle, the x-ray head is behind the person's head, shining through the spinal cord, the spinal column, onto the sensor or the x-ray film. And because of that, there's more dense material, there's more bone there, so it washes out the x-ray a little bit. So that's what you're looking at there. So again, let's take a look. Like I always like to do, I like to start on the bottom, work my way across, and then look at the top. All right, so again, just to orient you, this is the patient's right side. You can faintly see the little letter R down here on the image and the little letter L on the other side. That'll give you an idea as to which side is right, which side is left. Again, we're just facing the x-ray as if we're looking at the patient. Check out his jaw. I don't see anything in the posterior. Not even teeth. He's missing his lower right wisdom tooth and second molar. His first molar, or what's left of his first molar, it's still there. You can see it's kind of split in half. The back half of it is missing. The crack actually goes through the pulp chamber. I can see this kind of dark triangle here. That's what's left that's part of the pulp chamber. The rest of it would have been out the back here going down. And because of that, you can see this dark area around the distal root. So the distal root is the root towards the back. Mesial root is towards the front, towards the middle of the face. And this big area, we call that a periapical radiolucency, and it's basically just an abscess. It's this tooth, because the pulp chamber is exposed from how it's broken, it's abscessed now. Even this front root, I suspect there's a crack on the front root as well, because there's this kind of weird dark area extending all the way down to the tip, up the front of it, around the side here. So obviously this tooth is a goner. It's going to need to be removed. Two teeth in front, the two premolars. These don't actually look too bad. There still has a decent amount of bone there. I can see where the bone goes across, and about at least half of the tooth is still in the bone. This kind of dark area, though, that looks a little funny. It almost looks like the tooth is cracked. You can see it more so on the second premolar, not quite as easy to see on the first premolar. That's not a crack, though. That's most likely what's called an abfraction lesion. It's at the gum line, usually on the lip side. You get this kind of dished out area that can generally be from toothbrush abrasion. You're scrubbing too hard back and forth with your toothbrush, not like you should. Or it could also be from grinding their teeth. Although this person's missing the teeth right above it, so I don't know how much grinding he was doing on it. When he still had those upper teeth, he may have been grinding quite a bit. But I see those two teeth, they don't look that bad. Hard to see any decay. This isn't the best image for decay. And then this is canine here on the bottom right. Back side of it, the distal side of it, bone level's still fairly high. But then you look on the front and there's almost no bone on the front of this tooth. So again, most likely periodontal disease, which is what this patient does have as well. And this tooth, again, is a goner. Now, the front teeth, again, we said that this is just the spinal column being overlaid over top of it, so that's why it's a little hard to see. Everything's kind of washed out. But he's missing one or two incisors over here. He's missing the lateral and the central, but he's got the other two here. I could just barely make them out. And then he has his canine here and his other two premolars on the left. Bottom left, he actually has all his teeth still. I can see his canine right here. First premolar, second premolar, first molar, second molar, and third molar. And his third molar is actually a pretty big, well-formed tooth. Big, healthy roots on it, too. I mean, well anchored. Most third molars just have very small, stubby, conical roots that don't, its tooth's just like a little small, really rinky-dink thing for most people. He's got a fully formed tooth. Unfortunately, see this dark area starting on the first premolar, going around the premolars and then around the molars? That's just one pretty giant abscess. Pretty much all of these teeth are abscessed. Now, why is that? Most likely, well, he has periodontal disease, so that contributes to it. But then I'll also look at the second molar here and this dark area on the back side of the tooth, pretty much the back half of the tooth. That's a huge cavity to the point that it extends into the furcation. Furcation is the spot where the two roots meet. And from what I can see here, I wouldn't be surprised if this tooth had fractured there because it was so weak and thin. So this is probably in two pieces. Same thing with the third molar. Big area decay on the mesial root and again into the furcation as well. So all these teeth, everything's got to come out. That's what we already decided when we were at the treatment plan phase. He knew his teeth were bad and he didn't want to try to even attempt to save anything. On the bottom, we might have been able to save a couple premolars on this side. Maybe I could have tried to squeak out a few, maybe a year of life from his canine. I don't recall exactly how loose it was, but he decided, nope, I don't want him anymore. We're going to get rid of him. So let's go up to the upper jaw next. So the upper left-hand side, he's missing all three molars and his second premolar. The first premolar is right here. You can see it. It's got this kind of funky shape, and it looks kind of weird because it's rotated 90 degrees. So that's why it looks strange. That's not how they normally look. It's out of position. And also, there's very, very little bone left. You could see, there it is right there. He's got maybe 2 millimeters of the tooth still in bone. And then as you go back, there's very little left until you get to this little piece of root tip left over, most likely from his second molar, I'm going to guess. I don't know what it is, but it needs to come out. So another part of the discussion, this patient actually ended up going for dentures rather than implants, is on the upper left-hand side. You can see this is where the bone level is inside the mouth, and then this is where the floor of the sinus is. So basically, he's got 1 millimeter, maybe 2 millimeters of bone left in the back. So to be able to put an implant in, he would need a pretty big sinus lift and bone graft before he could even have any implants placed. So again, not in his budget, not something that he wanted to go through. So let's go back from the premolar. He still has his canine, lateral incisor, and his 2 central incisors. And again, cavity-wise, they look pretty in good shape, but again, just no jawbone. Let me just continue the level of the jawbone from back here. Let's draw it in. It comes up onto this incisor here. He's got maybe half of the roots still in the bone, but the other teeth, very, very little in bone. The teeth were all pretty loose too. So we had already made the decision that they were all going to come out. And then we move over to the upper right-hand side, and here he's actually got a decent height of jawbone left. The sinus floor is a bit higher on this side. He must have had these teeth removed before too much damage, too much bone loss occurred over here. Again, I can see that there's a decent amount of height. Width, you can't tell from this type of x-ray. You would need a CBCT, cone beam scan to be able to tell how wide it is. In the back, in the posterior here, he does have what's left of a second premolar. Crown of the tooth is completely gone, just the roots left, so that's going to need to come out. And then the only molar he has is his first molar. The upper first molar here has a amalgam filling. It's a silver amalgam filling. It's called an MO because it's on the mesial side of the tooth, and the O, which is the occlusal side of the tooth, the biting surface of the tooth. But the entire root has a big dark area all the way around the root of the tooth, a huge periapical radiolucency. Basically, this tells me that there's no bone holding this tooth in. The only thing holding this tooth in place is any type of attachment to the gum tissue. So this tooth is very, very loose. Probably you could remove this tooth with your fingers. It's probably so loose. And again, that's what we ended up doing. Actually, his teeth were in such poor shape, in such bad condition, that we didn't even attempt to make an immediate denture. I was worried if I tried to take even just an alginate impression, I was going to be pulling teeth out. Some of them were so loose. So we extracted everything, waited 6 weeks for his gums to close up and heal, and then we started making a set of permanent dentures. That worked out very well. One other thing I want to point out to you, see this kind of funky white thing over here? This is a couple earrings. We had a couple little diamond studs. See these little pointy things? Those are the settings that hold the actual stone. And then the round part down here is the back, and then there's the stud that actually goes through the ear. So little earrings like that, usually we don't have the patient remove them because they not that noticeable on the x-ray. If you had really long dangly earrings, yes, some J-Lo hoops, something big gaudy, something, yeah, we would have to get those, ask the patient to remove those so it doesn't block any of the x-rays. So thank you all so much for watching. I hope you enjoyed this video. I got a couple more coming up in the pipeline, so this should be interesting. One is a patient from Italy who has quite the collection of different styles of dental implants. And some of them are ones you never see here in the U.S. I don't think they've ever been sold or available for sale in the USA. And then I have another patient who has a whole bunch of dental implants from a whole bunch of different years, and you can see the progression of how long dental implants were years ago to what's being used nowadays. Thank you guys so much for watching. Any questions or comments, please leave them below. I try to answer every question and comment I get. Thank you so much.